Hi, my name is Jennifer Harrison, and I'm a social worker and chemical addictions counselor, and really proud to be a faculty member and the interim director of the School of Social Work at Western Michigan University. And I'd like to introduce you to some of my research and teaching foci so that if you are interested in some of the same things that I am, that we could possibly share work together, whether you're a student, a fellow practitioner, or a fellow researcher in the community. So in social work, one of the things that I like to study is the interaction between mental health services, substance use services, and primary health services, and the way that sometimes we see those operating in silos. But one of the things that we know is that people, when they experience a mental health condition, particularly a serious mental illness, they are much more likely to also experience a substance use disorder at some point in their life, and also more likely to experience chronic physical health conditions at some point in their life, so that we know that one illness imbues the risks related to the other illnesses, and that this goes back and forth. So most of the research as well as clinical practice that I do and the areas of teaching that I'm most involved in are interventions that are effective for people that have co-occurring disorders. So not only a mental health condition, but a substance use disorder condition, and frequently a primary health care condition, or it can work the opposite. Not only a substance use condition, but a primary health care condition and or a mental health condition. So that's some of my focus area, and one of the things that I'm most interested in from a research perspective is really getting into the weeds a little bit with implementation science, or how we actually implement the best evidence-based practices that we have. And one of the ways that I like to talk about this is by talking about that evidence-based practices don't start out as being written on stone tablets someplace, but they actually start out with great clinical wisdom that we have from social workers, from psychologists, from peer support specialists, from nurses, from occupational therapists, from different people throughout the allied health fields and in the behavioral health and physical health arena that have some great idea. And then hopefully they're able to translate that idea into some sort of research question, which means that they might be working with researchers either in their own organization or at a university or with a government entity that helps them to study what the actual implementation of this great clinical wisdom they have. So a research question that might come from clinical wisdom is, I think that people who are working in competitive employment are less likely to be hospitalized in a psychiatric setting. But you might not know whether one of those things is actually true or not, and that's why you have that research question. So then with the research question, we're actually going to perform the research, and hopefully, if the research bears fruit, develop something that's an evidence-based practice. Often evidence-based practices are in the form of toolkits that are produced, or tip guides, or manualized treatment that's something that we know is more effective than whatever treatment we had before. And then that evidence-based practice has to be translated into something that we can use in the field. And so this is the primary area of research that I'm interested in. How do we get what we know works in a research setting to be something that we know works in a practice setting? So that translation can take a bunch of different forms, but often we find that there's this science to service gap that occurs where the research that we know works never actually gets into social work and other related fields to be practiced, to be able to help people with contributing to their recovery and wellness, as well as resiliency. One of the things that when this is working right, when we can translate, then we can go back to this circle of the clinical wisdom, and we can actually not only develop evidence-based practices, but practice-based evidence, or research-informed practice, and then practice-informed research is one of the things that we'll talk about throughout social work. It's one of our competency areas, and it's one of the things that I'm most interested in my research, teaching, and direct practice as a social worker. Thanks so much, and hopefully you're excited as I am about research and teaching in social work, and also about the School of Social Work at Western Michigan University.